do men benefit just as strongly with the high fat approach, the 1 stick of butter a day protocol?
Okay, that would really depend upon stress. So I do think that women have more of a need for steroid hormones. So estrogens, progesterones, there are a lot of receptors there, and obviously testosterone as well. I do think that men benefit when there is a huge stress component. I think the way Raymond's eating is perfect. Fat trimmings and the ribeyes. I don't think that every male needs as much fat possibly as women do. That's just been my experience. I'm sure that if there are issues, hormone issues, testosterone issues, lack of energy, fatigue, things like that, they would benefit for sure. Absolutely reduced inflammation. And there's the question about the soy boy phenomenon, which is estrogen levels, which are caused by carbohydrates. So you remove the carbohydrates, you will lower estrogen. I would say unnaturally high estrogen levels. We have a lot of young men around here who eat a 100% carb diet, and they're looking that way when they reach adolescence. So adolescence, when the body is forming sexual characteristics, there's a whole lot of carbohydrate in the diet. The body will use that, and they will form anomalous sexual characteristics, which is fat adipose tissue in the pectoral area. We're all raised to believe that the more protein you eat, the more muscle you grow, but it's more that when you're ripping your muscle tissue to shreds, you need protein to regenerate it and to reform it. So I think that it depends on what activity you're really doing. Fat is energy. So I think that if things are running smoothly, the muscle the protein you do eat, it won't be used for energy. It will be more easily, it will become muscle because you have fat for energy. You're not turning it into glucose as you would if there were no fat.
Mm-hmm. And that seems to be, what they're after. That seems to be the goal with their physique, is to really lay down that muscle, but making sure that there's enough fat so that the protein can do the job, that the fat does the energy job, and the protein is available to do what they're actually wanting it to do.
Right. Yeah. Yeah. That's a good point. More carbs. We know that excess carbohydrate increases estrogen levels.
Yep.
That's why when you have polycystic ovary disease and you go on a low carb diet, the excess estrogen, which is growing anomalous tissue in the endometrium, goes away. So excess carbohydrate increases estrogen, and the boy boobs or the man boobs, whatever you call it, come from excess estrogen, which is caused by too many carbs. And I see it all the time in Italy, especially Southern Italy, where it's all pizza and if your parents ate a ton of carbs, you are epigenetically predisposed towards getting diabetes. So if your parents ate a lot of carbs, if they have sort of excess estrogen, that adolescent boy, his friend might be skinny as a rail and not have any and eat the same food, but that boy will have adipose tissue because of excess estrogen.
Maybe you can explain with your own experience, because before you went carnivore and high-fat carnivore, you were eating a standard American diet. You were eating all of the carbs, all of the junk. So what difference and impacts have you felt with your own body?
Yeah, I mean, I was developing more flab here, for example, since we're talking about but it wasn't pronounced like, some people that I've seen as I went carnivore. Even now that I put on a little bit of weight, because this is fall time for me, it never goes back to having that little soft. It's always hard. It's got muscle on there, so it's totally different. I used to suffer from ED very, very, very bad. So not eating disorder, and the other one,
erectile dysfunction. Yes.
Right, and that totally turned it around too. I mean, I want to say in the first 6 months I saw significant difference. Within the year was just kept on going more and more, and I thought that was very unusual. As my muscles started forming, though, that took about a year and a half before I saw the men boobs kind of peel off, and the layer of the extra inflammation on the stomach totally started peeling off. So it's very interesting to observe it in myself.
You mentioned men having ED. So what can men do for their prostate health?
Take iodine.
Take iodine.
Iodine. Okay.
There
For
are
prostate
iodine
too. Okay.
molecules. Yeah, absolutely. It's not just for women. That's very important. The prostate, I've had patients with prostatitis, and they took large doses of iodine, which took care of that.
Are there signs to look out for that issue?
Urine flow, the whole thing with pain,
Pain.
aching,
Okay.
lower back pain,
Mm.
even heel pain.
Heel, really? Okay.
Well, the lumbar spine, right? The lumbar spine innervates the prostate tissue. So those same, if you look at dermatomes, when we're a fetus, we our neural tube, the spine develops. Obviously, it's really small, and all that tissue, which when we grow, our arms are connected to our dorsal spine. So the pain in the fingers can be referred pain from the upper back, and foot and outside, inside, leg, knee pain can be referred pain from the lumbar spine. As intestinal pain, the lumbar spine also innervates the intestines. So I've had people come to me with bloating and incredible intestinal abdominal cramps, and I work on their lumbar spine, and that fixes it. Definitely address stress. More energy will increase libido, of course, right? So
Right.
lowering stress levels will increase libido. You're not distracted from, if you're not in fight or flight mode, you are able to concentrate on things that, if we're talking sexuality, that are pleasurable. Up until 1948, every single thyroid doctor was giving Lugol's iodine to their patients for hyper and hypothyroidism. The thyroid needs 12 milligrams, the breast need 5 milligrams. Mucus is incredibly, iodine is really important for all the mucus producing tissues. So sinuses, vaginal, intestinal. But the Wolff-Chaikoff, they basically used radioactive iodine on those mice. And radioactive iodine is the medical form of iodine, right? With all the medications are laced, the anti-thyroid medications are laced with radioactive iodine, right? Natural iodine is not toxic. Radioactive iodine is toxic. So they used radioactive iodine, they used tons of it. And what it did was temporarily, the thyroid was saturated with iodine. So it didn't need to take it up anymore temporarily for like 2 days, right? So they said that was hyperthyroidism, but they never tested those rats' thyroid levels. So we don't know if their thyroid, if their T3 was and T4 were overproduced, right? They never did this in humans. It didn't even show that those rats became hyperthyroid, right? So even Wolff-Chaikoff said in 1969 that it was a transitory effect, and that was not even, basically the study didn't work, right? It wasn't true. But medicine grabbed it, has never given up on that. And because iodine is natural, of course. So they recommend with the medicines, radioactive iodine, something normal and cheap like Lugol's, which gives your thyroid the potassium iodide, in your breasts, uterus, and in the men, prostate, the iodine, elemental iodine.
So in the Hakala Labs, the founder, he said that they did studies with 1 gram of iodine, and they have not shown any overdoing iodine. And we are recommending maybe like 12 and a half, even up to 50 milligrams, which is compared to 1,000 milligrams. So have you seen anybody in your practice like overdo iodine? Okay.
No, I have not. No, I have not. It's eliminated via the urine. There's always more chemicals in our water supply, in our air, that we don't even know about. And I just think iodine is a safe, cheap way to detox in the sense that sort of keep your mucus thriving.
Do you think?
Yeah. I mean, selenium's funny, it can become toxic. So it's kind of not like B12, or it's actually too much of it cannot be a good idea. And you don't need a lot. I think that in eggs, carnivore in eggs and meat can get an adequate amount. Usually we used to, as a naturopath, before I became carnivore, I used to recommend 200 micrograms. Now as a carnivore, I would max at 100 micrograms. If maybe on one of your tests, they come up really low. And then the cofactors, the other cofactors, they're in the meat, basically, it's the zinc, it's sort of in there. And that's why the carnivore diet is so great, that you have all these, if you're eating a plant-based diet, you're going to probably need some cofactors with your iodine in order to absorb it and synthesize it. But on a carnivore diet, I think you need less.